Bismillahirrahmanirrahim. The quote for today is have more than you show, speak less than you know. Welcome everyone. Today we will dive into the intricate world of service delivery system. I am Dr. Muhammad Vasgil and I am giving this presentation under the kind supervision of Professor Dr. Saira Afzal. Specifically, today we will focus on their significance in the realm of public health. This presentation aims to provide a comprehensive overview of the key components, challenges, and innovative approaches to service delivery within the context of Pakistan public health landscape. Now, the importance of the public health service delivery. It ensures the equity and access. Public health service delivery plays a pivotal role in ensuring equitable access to the healthcare services for all individuals, irrespective of their socioeconomic background. This is particularly crucial in Pakistan, where disparities in health outcomes are significant. By providing essential services, we can bridge the gap and promote health equity. The second number is disease prevention and control. Effective service delivery systems are instrumental in preventing and controlling the spread of infections and chronic diseases. By implementing robust programs for immunization, disease and surveillance, and early detection, we can mitigate disease burden and improve population health. Number third is promoting health and well-being. Public health service delivery goes beyond disease treatment. It encompasses a broader spectrum of services aimed at promoting health and well-being. This includes initiatives for health education, nutrition, sanitation, and environmental health, all of which contribute to healthier and more prosperous society. Number fourth is strengthening health system capacity. A well-functioning service A well-functioning service delivery system strengthens the overall capacity of the health system by coordinating resources, training personnel, and implementing efficient processes. We can enhance the effectiveness and responsiveness of the health system. Overview of the current service delivery landscape. There are three types of service delivery system in Pakistan. That is primary, secondary, and tertiary healthcare services. The key characters of the primary healthcare are basic services provided by the community health centers and dispensaries that focus on the preventive care and early intervention. While the challenges that are faced by the primary healthcare are the limited access in rural areas, inadequate infrastructure, and shortage of trained staff. While the secondary healthcare system has the specialized services offered by the district hospital and tertiary care centers, including diagnostic and surgery and specialized consultations. While it faces the challenges like the overcrowding, long waiting times, and limited access to the health essential medicines. The tertiary healthcare system has the characters of highly specialized services provided by the teaching hospitals and national institutions that focus on complex procedures and vast treatments. It faces challenges of high cost of services, limited access for low-income population, and reliance on foreign medical expertise. Health service delivery in Pakistan. The healthcare delivery system in Pakistan considers public and private sectors. Under the constitution, health is primarily the responsibility of the provincial government, except in the federally administered areas. Healthcare delivery has traditionally been jointly administered by the federal and provincial governments, with districts mainly responsible for implementation. Recently, the Ministry of National Regulation and Services plays a key role in formulation of policies, strategies, settings of vision, and planning. The operationalization of policies and laws lies on the provincial and local governments. There is a three-tiered healthcare delivery system in Pakistan. There is a government system, semi-government system, and the private healthcare system. Some government and semi-government organizations like the armed forces, prestacles such as Sui Gas, WAPDA, Railways, Fauji Foundation, and Employees Social Security Institute provide health services to their employees and their dependents through their own system, where these collectively cover about 10% of the population. The private healthcare sector constitutes a diverse group of doctors, nurses, paramedics, traditional healers, drug vendors, as well as laboratory technicians, shopkeepers, and unqualified practitioners. The government system in Pakistan consists of the federal government, provincial government, and the local government that starts in 2014. The federal government lays the health policy by federal government, implementation by the provincial government. From July 2011, responsibility and resources are shifted to the provincial government. From 2014, local governments have an important role in the health delivery systems. The composition of healthcare system. Healthcare system is primarily the responsibility of provincial government. Each province has Department of Health, which also regulates the private health sector. The survey of 2005 to 6 indicate that 67.4% households in Pakistan consume health providers in private sector when they have health problems. Other providers are Hakim, homeopath, and pharmaceutical tabibs. Government sector is low cost and the out-of-pocket patient is also free. This is the organogram of the healthcare delivery system in Pakistan. It involves the private sector that involves the major hospital, individually practice, general practitioner, teams, homeopathics, NGOs, philanthropic organizations, and traditional healers. While the public sector is divided into two, that is the federal government and provincial government. In the federal government, there is the Ministry of Defense, which regulates the military hospitals and other cantonment boards, while the ministries regulate the research institutes, hospitals, and vertical programs. In the provincial government, there are provincial departments of health, and they have three tiers of healthcare system. That's the primary, secondary, and tertiary healthcare system that I have already discussed. Next is the national health infrastructure of Pakistan, comprised of 12 approximately 1,200 hospitals, 5,500 basic health units, 683 rural health centers, 5,800 dispensaries, 730 maternal child health centers, 347 TB centers, and more than 1,23,000 total availability of beds, and there are more than 95,000 lady health workers. The private sector in Pakistan, the rising population pressure on the state health institutions has allowed the private sector to bridge the gap of rising demand and limited public health facilities. A number of private hospital, clinics, and diagnostic labs has increased considerably and is contributing health services in the country. Majority of private sector hospital has sole partnership or a partnership model of organization. Standalone clinics across Pakistan are the major providers of outpatient care. Majority of these clinics falls in the sole proprietorship of category. The key components of an effective service delivery system. It includes human resources, infrastructure, and financing. Human resources, adequately trained and motivated workforce is crucial. This includes doctors, nurses, community health workers, and other health professions. Continued education and training are essential to ensure up-to-date skills and knowledge. The infrastructure includes the appropriate physical infrastructure such as hospital, clinics, and community health centers. The infrastructure must be accessible, equipped with essential medical equipment, and maintained properly. The financing. Sustainable funding mechanisms are essential to ensure the long-term viability of the service delivery system. This may involve government funding, private insurance, user fees, and donor contributions. Transparency and accountability in financial management are crucial. The challenges and barriers in the service delivery are inadequate infrastructure. A significant challenge in Pakistan is the lack of sufficient and well-equipped health facilities, particularly in rural areas. This leads to overcrowding, long waiting times, and limited access to essential services. Number second is human resource shortages. There is a shortage of trained health professionals, particularly in remote areas. This limits the capacity of the health system to provide quality care and services. Investing in education and training for the healthcare professional is crucial. Financial constraint. Limited public funding for health is a major barrier to the effective service delivery. This results in insufficient resources for infrastructure development and equipment procurement. The personal uh, This is insufficient resources for infrastructure development, equipment, and personal training. Next is the inequities in access. Disparities in access to healthcare services against between the urban and rural areas and between different socioeconomic groups. This highlights the need for targeted interventions and strategies to promote equity in service delivery. Next is the innovative approaches to service delivery. This includes the community-based health programs. Empowering communities to take ownership of their health. This involves involving community members in planning, implementing, and monitoring health programs. Examples in community-based health insurance schemes, maternal health programs, and disease surveillance initiatives, and telemedicine and digital health. Leveraging technology to extend healthcare service to remote areas. This involves using techno consultants, mobile health applications, and electronic health records to provide remote diagnosis, treatment, and health education. Public-private partnership. Collaboration between public and private sectors to improve service delivery. This involves leveraging private sector expertise and resources to enhance the quality and efficiency of public health services. Data-driven decision making. Utilizing data analytics to inform policy and program design. This involves collecting and analyzing health data to identify trends, track progress, and allocate resources effectively. Data-driven approaches can help improve the efficiency and effectiveness of service delivery. Integrating technology in service delivery. Electronic health records. Implementing electronic health systems can improve data management, facilitate patient care coordination, and enhance data analysis. This can lead to more efficient and effective service delivery. Telemedicine. Utilizing telemedicine platform for consultation, diagnosis, and remote monitoring can expand access to specialized services in under-reserved areas. This can help bridge a geographical gap, improve healthcare accessibility. Mobile health applications. Developing mobile health application for health education, disease surveillance, and appointment scheduling can empower individuals to manage their health and access information. This can enhance the patient engagement and improve the health outcome. Data analysis. Leveraging data analytics to identify patterns and trends in health data can inform decision making and resource allocation. This can help optimize service delivery and improve health outcomes for the population. Stakeholder engagement and collaboration, community participation. Involving communities in planning, implementing, and monitoring health programs is essential for ensuring ownership and sustainability. This can be achieved through community forums, health education sessions, and participatory research. Collaboration with NGOs. Partnership with NGOs can bring expertise, resources, and local networks to enhance service delivery. This can involve joint program implementation, capacity building, and advocacy for improved health policies. Intersectoral collaboration. Working collaboratively with other sectors such as education, water, and sanitation and social welfare is crucial for addressing the social determinants of health. This involves coordinating efforts, sharing resources, and aligning policies to promote holistic health improvement. Health professional network. Establishing networks among health professionals can facilitate knowledge sharing, collaboration on research, and joint training initiatives. This can enhance the capacity of the health workforce and improve the quality of the care. Monitoring and evaluation of the service delivery that include the program monitoring and performance evaluation. Now the goals and expectations. Pakistan has failed to achieve the health for all and the Millennium Development Goals, but although Pakistan is stuck to achieve the Sustainable Development Goals by 2050, by 2025. Additionally, Pakistan has also set the National Health Vision that is from 2016 to 2025 to improve the health of the all particular women and children. Now the WHO score. WHO supports the National Health Authority vision and aim for reaching universal health coverage through the delivery of equitable and sustainable health services. The conclusion and recommendation. In conclusion, effective service delivery systems are essential for improving health outcomes and achieving the equitable access to the healthcare in Pakistan. Addressing the challenges and barriers, embracing innovative approaches, and integrating technology are crucial steps towards a robust and responsible public healthcare system. We must prioritize stakeholder engagement, data-driven decision-making, and continuous monitoring and evaluation to ensure that service delivery is effective and sustainable. For time for updates, there is an article that got published in 2024 that is about the artificial intelligence and in healthcare. Artificial intelligence powered rapid identification of ST elevation myocardial infarction electrocardiogram, a pragmatic randomized control trial. In this, artificial intelligence enabled electrocardiogram has shown potential for the accurate and timely detection of the ST elevation MI on 12 lead electrocardiogram. However, its effect on clinical treatment time is unknown. Here is the methodology of this article, and here is the conclusion. In patients with ST elevation MI, AI ECG assisted triage of STEMI decreased the door to balloon time for patients present to the emergency department. Door to balloon time is when the patient enters in the ER through the door, and the balloon time is when the physicians removes the blockade of the artery. So this is the door to balloon time. The AI ECG assisted triage of the STEMI decrease the door to balloon time, and additionally decrease the ECG to balloon time for the patients in the emergency room and inpatients. The next article is artificial intelligence assisted colonoscopy for colorectal cancer screening, a multi-center randomized controlled trial. In this, they have this multi-center RCT aim to compare the AI-assisted colonoscopy with conventional colonoscopy for adenoma detection in asymptomatic population. The conclusion of this article is this: in this multi-center randomized controlled trial, in asymptomatic patients, AI-assisted colonoscopy improved the overall adenoma detection rate and advanced adenoma detection rate and adenoma detection rate of both expert and non-expert attending endoscopies. Next is the effects of an artificial intelligence assisted health programs on workers with neck, shoulder pain, stiffness, and low back pain. It is also a randomized controlled trial. Musculoskeletal symptoms such as neck and shoulder pain, stiffness, and low back pain are common health problems in working population. They are the leading cause of presenteeism. This is the term that is usually used to describe the employees being physically present at work, but they are unable to fully engage. So the objective of the study is to evaluate the improvements in musculoskeletal symptoms in workers with neck, shoulder stiffness and pain and low back pain after the use of exercise-based artificial intelligence uh, interactive health program. The conclusion is this. They showed that the short exercise provided by the AI-assisted health program improved the back, neck, shoulder pain, stiffness, and low back pain in 12 weeks. Are needed.
और इसमें एक नहीं उसमें दो.
Further studies are needed to identify the elements contributing to a successful outcome of the AI-assisted health program. Now the time for the MCQs. First MCQ is a rural health center has been experiencing a high rate of patient dropouts in a chronic disease management program. The program requires the regular follow-up visits, but many patients fail to return there after their initial visit. As a public health manager, which strategy would you implement to address this issue? Whether increase the frequency of health education sessions to emphasize the importance of follow-up, hire more specialists to manage the chronic disease cases, centralized follow-up services in nearby or urban hospital, introduce a mobile health unit to conduct follow-ups in the patient communities, or reduce the number of follow-up visits required in the program. Which study would you opt?
He reduce the number of follow-up visits.
It's actually D. When there is a rural area, there is the major barrier that they will encounter is the geographical constraints. So the introduction of the mobile health unit will uh, uh, will be educated to address this issue. Second MCQ is during a public health assessment, it is found that a large segment of the population in a remote area does not have access to essential healthcare services due to geographical barriers. Which approach would be most effective in overcoming these barriers? Establishing a central hospital in the nearby city, or developing a telemedicine platform to provide remote consultations, conducting periodic health camps without follow-up services, or relying on self-care and home remedies, or limiting healthcare services to emergency cases only. Which would be most effective?
It could be B or C. Both of them could be.
It's B, developing a telemedicine platform that will address the issue as this is a remote area, so it will be the most accurate. B is the most accurate option. Third MCQ is a government health initiative is rolled out to improve the maternal and child health in under served areas. However, despite the availability of services, uptake remains low. What is the most likely cause of the low uptake and how should it be addressed? While the lack of skilled healthcare professionals recruit more specialists or cultural barriers to processing care engage communities leaders to promote the program or high cost of services subsidize healthcare costs for low income families or poor healthcare infrastructure build more facilities in the region or inadequate marketing of services increase public awareness campaigns. It's B, culture barriers to assessing care, engaging community leaders to promote the program. Fourth MCQ is a public health clinic in an urban area faces criticism for long waiting times and poor patient satisfaction. The clinic serves a diverse population with varying healthcare needs. Which of the following interventions would best address this concern? Reduce the number of services offered to focus on high demand areas, implement a triage system to prioritize urgent cases, increase the number of administrative staff to handle patient paperwork, schedule appointment for patients in cluster based on their conditions, focus on improving the clinic physical infrastructure. Which would be the most effective intervention? It would be implement a triage system to prioritize the urgent cases. Fifth MCQ is a community health worker program has been successful in rural districts, but there is a concern that community health workers are overwhelmed by the wide range of responsibilities they handle. What strategy would be most effective in ensuring the sustainability of the community health worker program? Assign community health workers absolute to one issue to reduce their workload, increase the number of community health workers without providing additional training, or provide targeted training and resources to support the community health workers in their roles, or limit the community health worker program to urban areas where more resources are available, or transition of community health workers to full-time roles with no additional support. Which would be the most effective?
A. Assign community health workers.
It would be the C. provide targeted training and resources to support the community health workers in their role. Sixth MCQ is a primary care facility in a remote area has been struggling with the timely supply of essential medications, leading to frequent stockouts and interrupted patient care. As the facility manager, what would you prioritize to resolve this issue? Whether increase the frequency of patient visits to compensate for medication delays, implement an inventory management system to monitor stock levels and predict shortages, reduce the number of medication prescribed to conserve supplies, focus on training staff to handle stockouts more efficiently, or establish a local pharmaceutical production unit.
B. Implement an inventory.
B. Seventh MCQ is after a natural disaster, our district health office is tasked with quickly re-establishing basic health care services. The affected area has limited access to infrastructure and resources. What would be the most effective first step in restoring health services? Whether rebuilding permanent health facilities immediately, developing mobile health unit to provide essential, conducting a comprehensive health need assessment over the several months, waiting for the international aid to arrive before taking action, or focusing on long-term healthcare program for the outset. It's B, developing mobile health units. Eighth MCQ is a national health policy is being developed to address rising non-communicable diseases. The policymakers must decide on most effective way to integrate NCD management into the existing primary healthcare system. Which approach would most likely to uh, successful integration, whether establishing specialized NCD clinics separate from the primary care, train primary healthcare providers in NCD management and prevention, focus solely on tertiary care for NCD patients, provide NCD management exclusively through online platforms, limit NCD services to urban areas where demand is highest. It's be train primary healthcare providers in NCD management and prevention, as the primary healthcare providers are the first point of contact where the patients meet with the healthcare provider. Second last MCQ is a newly introduced electronic health record system in public health hospital aims to improve patient care and data management. However, staff are resistant to using the new system, citing it as too complex and time consuming. Which strategy would best address staff resistance and ensure successful implementation of the EHR system? Mandate immediate use of EHR system without additional support, provide comprehensive training and ongoing technical support to all the staff, abandon the electronic health record system and revert to paper records, limit the EHR system to the administrative staff only, introduce penalties for staff who fail to use the electronic health record system. It's B, provide comprehensive training and ongoing technical support to all the staff. Last MCQ is an evaluation of a health intervention program reveals that while the program has achieved its immediate objectives, it has not been successful in creating long-term sustainable health outcomes. What is the most likely reason for this, and how should it be addressed? The program focused too much on short-term gains in corporate sustainability planning from the start. There was insufficient funding, increased budget allocations. The target population was too broad, narrow the focus to specific regions. The program was too reliant on external experts, involved local stakeholders in planning and execution. The intervention was too innovative, stick to additional methods. It's a You have to focus on long-term planning. This is the key of the MCQs. This is our community medicine, King Edward Medical University YouTube channel where all the presentations of postgraduate residents are uploaded here. And thank you very much for today.